All right. We may have a few more folks joining us. I can see we're almost full with our participant list, but we're going to get started so that we can get through a lot of information that we're delighted to share with you today. And thank you again for joining us. Some of you may have joined us about a month ago for the initial 4C for Children briefing on childcare in our region. I'm Vanessa Freytag. I am the 4C for Children President and CEO. Definitely a pleasure to share an update with our community. I will also be joined by Kim Ginn, who is our VP of Program Operations, who also has a couple of decades of childcare experience and has been leading our work, especially through this pandemic and now the reopening, and has some great information to share with us today about what's happening. A quick overview for those of you who are not familiar with 4C for Children. We are what is known as a Child Care Resource and Referral Agency, a CCR&R is the lingo. And that is an entity that is contracted. The state designates one agency per region to really be the arm of the state when it comes to working on things like training, coaching, which is really helping instill those learnings in a classroom. And in particular, many of you may have heard us talk over the last couple of years about our work in assisting childcare programs to reach quality, the educational quality hurdles that the state of Ohio has set out. We are responsible for 2 regions, Southwest Ohio as well as Miami Valley, and that encompasses 15 different counties, and it encompasses more than 1,400 childcare programs, so a lot of programs in these regions. And our format today, I'm going to quickly run through just a bit of a timeline and bring you up to speed to where we are today with childcare in our region. Then I'm going to hand it over to Kim Ginn, who, as I said, is our Vice President of Program Operations. She's going to share some deeper information with you about some surveying that we've done and what we're seeing in the field with childcare in our region. And then will come back to me to also give you an understanding of what we are seeing as some of the needs in our regions and some of the ways we hope that our community can help and assist with ensuring that every possible child care program is able to reopen its doors and, importantly, continue on this journey for quality child care. Because every child that is kindergarten ready is on a path to, greater success in school and in life. And that also is the essence of our mission. So, and then we'll have a Q&A at the end. And there's a couple of ways for you to do that. You can put your questions in the chat box that if you're on video, I'm sorry, thank you. You can put your questions in the Q&A box, not the chat box, the Q&A box that you should be able to see at the bottom of your screen if you're on video. And if for some reason you are not able to do this via video, you could also send an email to Alona Piascovi, who is the person that sent you your registration. And we'll be happy to pick those up from there. So just a quick summary of where we are. As you know, as we moved into this pandemic timeframe, childcare was right in the epicenter, really, of it. Childcare eventually shifted from what was our traditional rules and our traditional childcare settings to what was known as pandemic care. Pandemic care, I'd say some of the big parts of that are that that is where the state started to put some guidelines in place for safety and for health reasons, especially in those early weeks when it was not clear about transmission levels and a lot of other concerns. And so childcare, almost all of those pandemic programs were existing licensed programs who said, yes, I want to apply for a pandemic license. And we had many hundreds of programs that said they wanted to do that. About a third of the center-based programs in our regions and about half of the family childcare. There were a few folks that opened, in essence, new programs temporarily. Those tended to be at like a hospital setting. Weren't too many of those, but a few that did that. But for the most part, it was existing programs that chose to follow pandemic guidelines. The rest of the programs went into a temporary closed status. And one of the things that's important to note about our state is the state of Ohio has done a number of things to try to ensure that childcare is successful in getting through this economic downturn and then reopening, which is where we are right now. So one of the big things they did was they decided to continue to pay childcare programs who serve publicly funded children. They continued to pay those programs for those seats, for those children's seats, while the programs were closed. So this allowed programs to do things like pay their rent. Well, they had no income coming in otherwise. They could pay teachers to help stabilize the teacher base, because we were going to need every one of those teachers as we reopened, and to keep themselves in a ready mode for reopening. We went into that mode March 25th, March 26th, I think was actually the first date for pandemic care. And then, as you know, the state has indicated that reopening could happen. In essence, programs could reopen on June 1st. And so we have obviously been in the mode those week or two before that initial date of reopening, helping programs reopen, as well as now, and we're still in the process of helping programs reopen right now. So that's where we are at the moment with our status on childcare. And what I would tell you is that there are still, and Kim's going to talk a little bit more about this, there are still restrictions in place, guidelines in place that are keeping our childcare programs, for example, at smaller child ratios. And to understand childcare, it's important to understand that by far the largest expense in childcare actually is your teachers. And that's a good thing, because we know that child-teacher ratios are intimately connected to educational success. But when you reduce the number of children from the standard ratios down, what that does is it really exponentially increases the gap between what a childcare program is receiving in funding and from parents, or could be from state payments, and what those actual expenses are, because you still need either the same number of teachers, fewer children, or you might need more teachers to handle those children. So I'm going to hand it over to Kim, who's going to talk a bit about some surveying we've done to understand what's happening as we reopen, as well as talk a little bit more about some of the other things that our state is doing to help our programs navigate this very difficult period of time. Kim, I'll throw it over to you. Yep.
Thank you. All right, great. All right, so as soon as the governor announced the reopening of childcare, 4C worked quickly on a survey to determine who would be reopening and when, what their anticipated capacity would be, and then what concerns they had regarding reopening, such as financial or obtaining supplies. So what we have learned from the information gathered from that 4C for Children survey, and with the program information that we received from the Ohio Department of Job and Family Services, is that as of June 5th, about 1,400 programs in 4C's 2 regions, 15 counties, do plan on reopening. That's about 1,200 plan on reopening by June 30th, another 200 in July or August timeframe, and then the remaining of those in September, which a lot of those are half-day preschool or Head Start programs, and they wouldn't have reopened until September anyway. Now, programs did have until June 7th to indicate their intentions on reopening. So we are waiting on the latest program information from ODJFS to finalize our numbers, and we hope to have that information this week. And so there is a 2-day gap in the June 5th data that I just shared, and then when the programs had to respond to ODJFS on their intentions on reopening. So of those programs that did respond to the 4C survey, many indicated they had concerns over really being able to stay in business because of the lower ratios and group sizes that Vanessa mentioned. We know that lower ratios are in place for the protection of not only the children, but also of the staff and families. But financially, we also know a program cannot sustain those ratios without financial assistance. Also, the lower ratios have caused concern with programs keeping their staff because they are not able to have all of their staff come back right now due to the low ratios, which that can have a great impact on staffing once the ratios are increased if those teachers find other job opportunities. Low ratios also mean less capacity for children that the program can serve. And so we have learned in our survey that program capacity has decreased by about half, if not a little bit more, which could mean waiting list for parents needing care. And we do know that there are many programs that do have waiting lists for families. That is a reality. But then there's also programs out there that are struggling to fill their vacant spots. And so both scenarios are an interesting place to be, because with the lower ratios already putting a burden on the program financially, if they cannot fill those spots with enough children, that causes even more financial strain. So that is one reason why 4C, we do have the latest program information on reopening, so that our family and community service specialists can personally assist families in finding the care that they need and help ensure that those programs are filling their spots. There was also a concern mentioned in the survey regarding the higher expenses due to the new requirements and availability and access of cleaning products, hand sanitizers, soap, paper products, thermometers. Programs have always had to purchase these types of materials, but now with the increased use of the materials, and then also other businesses also required to use these materials that maybe never did before, access and affordability are definitely concerns of the programs. The 3 top concerns for all programs on reopening and the ability to obtain these supplies, it was hand sanitizer, cleaning supplies, and thermometers. For center-based programs in Type A, family childcare, which is our larger family childcare homes, a big top concern for them was also meeting payroll because of the low ratios. So some other concerns from programs, they include being able to afford additional materials required to meet the new requirements, to avoid the sharing of toys and play materials, also more outdoor equipment to ensure the health and safety of the children while they're outdoors, which is much needed to go outdoors during these times. And all times, outdoors is very important. And also, programs are concerned about the spread of coronavirus itself and how to keep everyone, including their staff, children, and their families well. But some good news is something we had worried about was teachers returning to their programs. But most programs, what they're finding is that the teachers want to come back to work. The programs have done a great job of engaging their staff, even if they were closed during this time, to ensure that they could come back when it was, time was ready. The concern is now shifting to not the teachers wanting to come back as they do, but because of the low ratios, programs not being able to bring back all of their staff at this time. So 4C, we have been really helping address these concerns that the providers in our region have been going through. We have been providing daily communication. We've also been doing coaching sessions. Coaching has not stopped, as well as training has not stopped. We have just pivoted and have adjusted and have been innovative in the practices that we're doing. In our daily communication, we have provided the most up-to-date information from the governor's office and from the Ohio Department of Job and Family Services regarding childcare, and have provided answers that the providers have asked regarding reopening requirements and also the state grants, which I'll talk more about in a moment. And like I said, our coaching never stopped. We moved to a virtual platform using Zoom meetings, also email and phone, and continued that one-on-one coaching. And we also continue to ensure that the providers in our region have the support that they need. So in addition to that virtual one-on-one coaching, we have developed online tools, we have developed coaching videos, and we began offering open coaching sessions via Zoom with an average of 70 participants. And we do those twice a week for our regions. So providers still want support, they need support, and they want information, and we have been providing that for them. 4C also quickly adapted how we deliver training and have offered over 65 virtual training sessions. We've even adapted our CDA program into a virtual delivery to ensure that the 100 students that were enrolled at the time of the shutdown were able to graduate on time, and they did. And we have had over 100 students starting a new CDA cohort this month, so very excited. But due to the funding from the state, we have been able to offer all of that training free. So all of our virtual training has been free for the past 3 months, which really helped take that financial burden off of the programs, whether they were a temporary pandemic childcare program or if they closed but still wanted to continue to learn and develop during that time. The training we offer help programs continue to work on quality, which quality is still just as important, if not more important than ever before. We need quality programs for our children. The training also addressed needs of the providers, such as appropriate hand washing and sanitizing procedures that they needed to implement. It really reinforced what they've always done. Those have always been procedures that the state of Ohio have required even before the pandemic, and so we helped reinforce those. And we also help prepare the providers to reopen strategically and safely, and we see that they are doing that. One provider stated on the survey, the communication from 4C has been so clear and helpful as we navigate these consistently changing circumstances. The development of so many free online virtual training options was just awesome. Thanks for being in our corner. So you're welcome. So now let's talk about the grants. So even with these kind words, we know that childcare right now is extremely fragile, and the state recognizes that as well. That is why the state has allocated $60 million from the CARES Act to offset all of the costs that I just talked about that providers have concerns about. So there are 2 separate grants that will be available. One is a COVID-19 payment, and that payment is for all providers. That would include childcare centers, that would include type A family childcare, type B family childcare, so that's large and small family childcare providing care in their home, and also day camps and in-home aides. The COVID-19 payment, those grants are intended to provide assistance in covering the cost of COVID-19, like classroom dividers, cleaning supplies, personal protective equipment, temporary sinks, thermometers, and other expenses related to COVID. There's also a second grant, and that's a ratio support payment, and that is for centers only. And that is really a payment that's intended to support childcare centers and the cost that they are going to occur because of the result of reduced ratios. So let's start with the COVID-19 payment and how that works and what that will cover. So centers, we're going to start with centers first. So that COVID-19 payment is for both centers and family childcare, but we'll start with centers because it is implemented a little different. Centers will have payments based off of the program's star rating and their license capacity, which is broken up into like a small size center, medium, large, and extra large. So the lowest amount that could be received from a center would be $250. And that would be a monthly payment. That's for a small, unrated center. So they don't have a star rating and they're considered small. And the largest amount received for this COVID payment would be $6,000. And that's for an extra large center with a 5-star rating. Family childcare providers will have payments based off the type of program, whether type A or B, so large or small family childcare, and also the program star rating. So the lowest amount received for family childcare for the COVID payment would be $500, and that's for an unrated type B provider, with the largest amount received being $1,500 for a 5-star type A provider. And as I stated earlier, these dollars are to be spent on covering the cost that's related to COVID-19, such as the classroom dividers, which are now required to keep groups of children separate, cleaning supplies that they are going to need to ensure that the program is that's safe for children and that children are healthy, personal protective equipment that is required. Masks are not required, but they're highly recommended. In most programs, the teachers are wearing them. Temporary sinks, thermometers, and other related expenses that kind of fall in that keeping children healthy and safe. A reconciliation will be required for each payment received. So it's very important that programs maintain great records, and 4C is here to support them with that as well and help them through this, that they need to retain any receipts, invoices, and any documentation that they have for any expenses that they have made. So now let's talk about the second grant, and that is for child care centers specifically. And this is what they call a ratio support grant. So this payment is intended to support child care centers as a result of reduced ratios. So just to give you an idea, ratio for 4-year-olds before all of this was a 1-to-14. So one teacher could have up to 14 4-year-olds. Now it's a 1-to-9. So one teacher with 9 4-year-olds. So just wanted to give you an idea of what that reduced ratio looks like. And it's different for each age group. So this will be based on the enrollment of both private paid children and those receiving publicly funded child care dollars. The children reported as enrolled must have been served at least 1 day prior to reporting, and the program must be open for no less than 2 full weeks in the month of June to receive these support payments. So basically, they have to reopen either by Sunday, June 14th or before to be able to qualify for these dollars. These payments are intended for all of the things that the other grant is intended for. They can use them for this as well. So the classroom dividers, cleaning supplies, PPEs, temporary sinks, thermometers, and other expenses, but also they can use this to offset the personnel cost for the staff working in the reopened classrooms. So that's really what the big difference in these are. This payment is based on the number of children served and the star level, with $250 being the lowest for an unrated program serving up to 6 children, and $22,820 being the highest for a 5-star program serving 76 children or more. And once again, reconciliation is required for each payment received. So programs have to have great record keeping. They have to retain all receipts, invoices, and documentation for those expenses. Things that aren't covered in these grants include training costs. So any professional development that would be needed or required is not covered. Construction, if they needed to, remove a wall to create a larger space to have, different groups in a classroom, that would not be covered, or capital repairs. So items such as that are not included in these grants and not covered. So in order to apply for one or both of these grants, a provider must have notified ODJFS of their reopening. and apply through their Ohio Professional Registry organizational dashboard at okra.org. So OCRA, the Ohio Child Care Resource and Referral Association, is the one that is distributing and will be working on the reconciliation of these grants. Now, even with these substantial grants, because $60 million sounds like a lot of money, the money will run out. We anticipate with the number of programs reopening that the money will probably only last through July. So if ratios and group sizes do not increase by then, we do have concerns and fear many programs will not be able to endure the financial strain and could potentially close. And so then, we're not sure what will happen with the children and the families that need that care. So Vanessa, on that note, I'm going to send it back to you.
Need to unmute me. Great. All right. Thank you, Kim. Yeah, a bit of a dark note, but a couple of things to just share. To put some of this in context, I would just remind all of you that as best that we can tell, and obviously all of us are following the reopening process for all the different industries in the state. This is the only industry that we have seen that is receiving reopening grants. And the important part of that is I think that we are at a place now, those of you that have been friends and partners to 4C for, in some cases, decades, you know how hard it has been to get our communities to a place where they understood the critical role that childcare plays. And that role is certainly about the education of our children. But I think what we've also helped folks understand just by the process of what's happened through the pandemic is childcare is literally an economic infrastructure component. And that has been a story and a tale that we have tried to share over the last few years and found some understanding of that. I think we're definitely the place now that our communities understand it, certainly our elected officials understand it, and truly the state's doing a great deal to try and ensure that childcare successfully reopens. So that, even though there isn't enough money, the money that was committed to this is a very, very big step. And that is not something that has happened in every state. So I would just preface my comments with that. Second thing that I would say, and I would hope that all of you would carry this message to wherever you go after we are done with our discussion today. Childcare is safe. It is open and it is safe. And I know that parents, I had young children. I was a working mom when my children were young. They went to childcare. I did not, though, fully understand the breadth of childcare and the training it takes to be a licensed childcare provider. Obviously, I have a much greater appreciation for that now in the role that I have and with wonderful parts of our team like Kim that have helped me understand this. So safety, licensing is predicated on health and safety. So our providers in our community were learning about sanitation, hand washing, all of those things long before the pandemic ever occurred. What's different now, a couple of things. One is there is more frequency of that because of the extreme transmission of COVID-19. Some of the ways in which you might have children share spaces can't be done until we're at a better place of treating and understanding COVID-19. And then as Kim talked quite a bit about, the ratios are smaller, again, to reduce transmission. So very important. I just personally ask you to take that message wherever you go, that childcare is open and safe. Second thing I would share with you is that, as a community, I know there are a lot of businesses that are listening to this, and I've gotten lots of questions, and our team has too. What do we do? Our staff that work at a manufacturing firm or at a bank or wherever you may be, they're struggling with childcare needs. So a few things I would suggest. One is This situation is really dynamic right now. It is literally changing week to week, and typically changing in a positive way, meaning more and more and more programs are reopening. So it is a moment in time where it would be a very good idea on a very frequent basis to update the status, have that conversation with your staff about their childcare needs, every week. Because those that may be struggling with that answer today, by next week, their program may be open. And as Kim said, it's an odd mix too of programs. Some programs are at capacity right now, some aren't. So there's a mix there too. Part of our job as a resource and referral agency is to assist parents. There is no charge to this. This is part of what the state funds us to do. We can help a parent if they're trying to figure this equation out. And if there is an answer to be had that meets their needs, whether that's location or the age of the child, we'll do all that we can to help them find that solution. I would also point out that we are going to start to get to a place where the reason why one of your staff members may not have childcare accessible to them may differ from family to family. It is really important to ask that staff member why. So in some cases, there are parents that are not bringing their children back to childcare. And it's not because they're worried about the safety of childcare. It's because they may have an immunocompromised family member. And so any exposure outside the home is something they're trying to contain. Now, that's a very different situation than, hey, my child care isn't open yet, or it doesn't have capacity. So I would encourage you to really have your leaders, your supervisors talking to your staff members really on a one-on-one basis in the next few weeks to understand where they are in this process and why there may be a struggle for them to have childcare as you're asking them to come back to work. The last part of what I'd like to share, and then we will be jumping into some Q&A, is, and Kim started that conversation about, so now what? We've got this great funding that is coming from the state. And here's what we're concerned about. The first thing I'd say is family childcare, although they're getting the COVID-19 payment, part of the reason they're not receiving the ratio payments is because for what are the most common type of family childcare, which take up to 6 children, that ratio differential isn't hitting them. But here's the problem. If they happen to have a group of families they normally serve, and several of those families are not ready to bring their child back, or perhaps some of those parents have lost their job, so childcare is not something they're seeking right now, there is a gap that will happen there. And we're concerned about that. We only have that from an anecdotal perspective right now, but it is one of those things that we are keeping an eye on, because as a community, one thing to know is over 50% of our childcare programs are family childcare. So we can't afford to have a single family childcare not be able to stay open or reopen. So that's a piece of funding that we are keeping an eye on, and we would have to put that funding together as a community to assist those providers. Second thing, Kim alluded to this, the training. 4C was able to repurpose some dollars we had that were actually not about COVID-19, but a different set of work the state had asked us to do, and allowed us to provide all of this training that did a lot of important things. That Child Development Associate, CDA, that is if you think of different levels of certification for, we have sort of STEP certification in healthcare, for example, that exists in childcare. It is one of the most fundamental components of teachers earning that certification, and then it's critical access to the path to high quality then for that program. So those, the ability to offer those kinds of things at no cost literally ends June 30. So the pocket of money that we were able to repurpose from the state has a hard cutoff on June 30. Our desire is that for the next quarter, so that third quarter, July, August, September, if at all possible, we believe it is critical to continue to offer the trainings that programs need at no cost. You've heard they have all these other burdens that they are trying to navigate, and they're getting some help from the state. There are no extra dollars, for sure, in the childcare programs to support the training that their staff needs. So that's an area that we are going to look to the community to help us continue this trajectory, because we know already from the 2.5 months that we've been able to offer it, it has been a vital lifeline to our childcare programs to continue that. There's also, this issue of, so what happens after the end of July? And that is an estimate, just so you know, but it's also the state's estimate. It's not just ours, that these dollars are likely to run the course by the end of July. And this is sort of good and bad news. The good news is that means that there's a whole lot of childcare that reopened. That's a great thing. But the more childcare that reopens, the faster those dollars are used. So again, we don't have a final set of guidelines yet from the state, but our best estimate is that ratios won't return to normal until the schooling, the K-12 school side is in full swing. So, that's really September. And that's why we're looking at that August timeframe as a critical timeframe. And again, the state's done some amazing things, but there are no more dollars after July. So we want to be sure that we don't have a situation where childcare reopens, it has a lot of support, and then they literally, just fall off when we get to August. That would be a disaster for childcare. It would be a disaster for children, and it certainly would be a disaster for the companies and their employees who are relying on that childcare so that their employees can come to work. So those are some of the things that we are navigating back and forth right now. As I said, it's a really fluid situation. We are looking forward to seeing the complete set of data that the state has now collected, because the cutoff on that survey was the 7th of June. It'll probably take them a few more days to pull that data together. And at that point, what happens to a program if they have not indicated that they're going to reopen is they will be put in a temporary close. So whether if they've said, no, we're not reopening at all, that's one thing. But if they haven't said if they are or they aren't, their license actually goes into a temporary closure. So at that point, once we have that data, and we will certainly be sharing it with all of you in the community, we will have a really good idea of this interim period, what the gap in childcare is from what we had pre-pandemic to now. I can't say post-pandemic because we're still in it, but mid-pandemic perhaps. And that will be an important moment for all of us to come together and figure out, what are the barriers for those that perhaps aren't open, and so what more might we do as a community to help everyone who could open reopen. So I think that's everything that we had in terms of sharing. We are certainly going to be sharing some of the data that we've given you so far about, and I'm just looking at my question marks here. We're going to be sharing, there's a question about sharing this information. So we will be sharing it out so that you have it. But I would also, again, say, understand this is what we know today. That's not the same as what we might know tomorrow or next week. So we will keep updating this. Everyone who is participating in this call, and actually our previous call, you will be part of our update list. Many of you already are, as we send out new information about the status of childcare in our community. So let me turn for a second to Alona. Did we have any other questions in addition to that? Okay. So I would just offer, how are we doing on time? We're doing great on time. That if there are any final questions, you're welcome to put them in the chat box, Q&A box, and we will be happy to answer those. And Kim, I don't know if you're still muted. I'm wondering if there are any questions that you have also received from individuals or companies about this. I know I covered the one about what do I do about my staff who may be saying they're having difficulty finding childcare.
No, I mean, I know some of the questions that are out there is, about the providers, if we know, how many will be reopening, and I shared that information, and we'll hopefully get a finalized list from ODJFS either at the end of this week or early next week, because programs did have until the 7th. So I know that was a question. And then based on the guidelines about a sense of projected shortfall in the available seats. And, right now we're seeing about most programs were reporting about half capacity of what they originally had. Going back to my example of a 1 to, a ratio for 4-year-olds was a 1 to 14. Now it's a 1 to 9, but it's also even less than that because the group size is only 9, where they could have had double the group size. So they could have had 28 4-year-olds in a classroom with 2 teachers. Now you can only have 9 with 1. So 28 and 9. So yes, we do, we'll have a shortfall in capacity until ratios are increased. And I just want to reiterate what you said, Vanessa, that childcare is safe. The hand washing, the sanitizing, everything that the CDC has been recommending and our governor's been recommending, childcare has been doing that. Those guidelines have always been a part of just what we do. Hand washing and how to hand wash and how to sanitize a table and sanitize the toys and equipment. So it is safe because that's just what we do. That's what we've always done. So I just wanted to say that.
Part of the profession. And, one other thing that I would share, one of our concerns in the long run is the digital divide. So something to know too, we've seen a lot about the issues of the digital divide, the issues of equity, how that breaks down on income and race lines. And that is true in childcare also. So one other thing I would share with you that we are also working on is this remote delivery of training. And you must have a certain amount of training actually to maintain your licensure as a teacher, as a program, not to mention the fact that there are new and important components of learnings that are coming up that teachers and programs need to stay on top of. So although 4C for Children was able to very quickly shift our training, and we've had literally over 600 attendees at the training programs just in the last, I would say 2 months, but the reality is we actually went dark on our training for a couple of weeks because we needed the time to turn everything into a remote delivery. So it's really not much more than a month that we've had that kind of participation. We are concerned that remote delivery is going to have to continue to happen to keep everyone safe in part, and we can't do large groups of training, things like that. And there's a point at which the fact that programs either don't have the hardware or they don't have internet access or they don't have the skills and comfort with technology, this is going to become a really important issue that could exacerbate the equity issues when we look at childcare programs that are, particularly those that are serving many of our populations that are struggling. So this is one other area I would share with you. We'll stay on top of that and we will continue to give you an update on, but it's another area that we are going to ask our community to help us really resolve that, because we also think, and I'm sure all of you have heard it too, the remote delivery of a lot of things, not just training and the work of 4C, is clearly going to continue. And we have got to resolve the digital divide now, especially in childcare, before it becomes an issue that is dramatically impacting the lives of our programs, our teachers, and our children. So I would say look to hear more from us on that, but that will be one other area that we're going to reach out to the community and look for help on that. So I think that's everything. Alona, let me just check. Any last questions? Okay, so we will be getting back to you with some highlights of this briefing, and I would anticipate that we may do another briefing as time goes on through this pandemic timeframe. And thank you so much for giving us an hour of your time, and we're here to serve the community and serve you, and just reach out to us if there is anything that we can do to help you or a child care program you need. Thanks, everybody.